It's Dr. Earle here at Pure Plastic Surgery, and it's Hump Day with Dr. Earle. All right, this is the time I get to spend with you guys, and of course answer all your burning plastic surgery questions. So today we're going to go on a little bit of a topic here regarding, what I think are some of the most important things that you can do in order to get great long-lasting results. Okay, so we're going to go a little bit into that. We're going to discuss several of those topics, and then of course I'm sure we'll have some time left over to answer a whole bunch of questions. Okay, all right, so there's been plenty of times where I've seen a absolutely beautiful on-table result, and then 3 months down the line things just don't look the way they should. Okay, and typically the reason for that is that the post-op care was suboptimal. So what I really want to kind of bring home with this topic here today, what we're going to talk about here today, is that what happens after surgery, it's just as important as surgery day itself. Okay, it's equally as important. So you can't expect to just have surgery and then not change your habits, not do anything else, not follow post-op care or instructions, and still have a long-lasting fabulous result. Okay, all right. So the first one I want to start with is the one that's, I guess, a little bit the most controversial, in the sense that there's certain things that we can't control regarding this, and that's of course the starting foundation. Okay, so it's quite obvious that if you have a great foundation to start with, that you're then going to have a awesome result. Okay, so it's like that saying with the painters, it's all about the canvas, right? So when we talk about foundation, then of course there are some things that the patient can control, and some things that the patient just simply cannot control. So for example, once you get to surgery day, there's really not much that we can do regarding, say, your skin laxity, right? So if you have skin laxity, you have loose skin, maybe you've had a few pregnancies in the past, maybe you've had massive weight loss in the past, or you were a smoker or something like that, then once you get to the OR that day, there's really nothing we can do about that skin laxity that day. So it is what it is. But there are a few things that you can do, say before surgery, to try to optimize your results. So one of them is, of course, coming in, say, for example, with an optimal BMI, right? So say if your BMI is 30 and you're able to, in a healthy way, bring it down to, say, 26, you'll probably have an overall much better result. Same way, if your BMI is 20, you're looking for a BBL, you may need to gain some weight, kind of increase that BMI to at least 22 or so, so you can have a better result. So, little weight gain or weight loss, depending on your situation, is something that you can control to try to come into surgery with a better foundation. Another thing you can control, of course, is smoking. So it's best if you've never smoked, but the more time that you spent, off nicotine, the better probably your skin, your skin's going to be when you come in, and the better also your results in the long run. So smoking is certainly something that you can control. Also, you want to come into surgery, of course, optimize in terms of your nutrition, and importantly, optimize in terms of your hydration. Okay, so it's going to be a much easier and much better recovery for you if when you come into surgery, you're adequately hydrated and your tank is full. If you come into surgery kind of dehydrated, surgery is going to dehydrate you more. It's going to make your recovery a lot tougher. It's going to make you perhaps a little bit weaker, feeling a bit more lightheaded. That's going to make it so you can't move around as much during surgery. Perhaps you can't tolerate some of the early massages, etc., etc. And all these things add up, and then eventually your result might not be as great as as it could have been. Okay, so but like I said, there are some things we can't control. Your skin laxity is something we can't control. Your bony structure is something that we can't control. So for example, if your underlying skeletal structure gives you wide hips and a rib cage that's small, then it's much easier to get a very dramatic look, right? Because you can always shrink in that waist, and then you already have kind of the wider hips given your pelvic bones. Okay, so. And if you come in with a little bit of a wider rib cage, and a small pelvis, it's much more difficult to then, create a very dramatic, vixen or hourglass type shape. All right, so bony structures is something that we can change. The other thing that's very common regarding the bony structure is scoliosis to certain levels. So where the spine, okay, and also the pelvic is kind of tilted to one side or another. That, of course, leads to some asymmetries that we can see, on the outside, and that's something that we cannot change. So if you come in with one hip that's a little bit higher than the other, then of course those hips will never be perfectly symmetrical, and that just can't be the expectation. Okay. So, but of course, like I said, we just can't control that. So first thing, like we said, foundation, very important. Just try to optimize your foundation when you come in. Okay. The next thing, of course, is going to a consistent and safe surgeon. All right. Safety, of course, because you want to make it home, right, to your family and kids. I mean, that's without saying. For me, this is the number one priority. That's why it's so important here at Pure. We do absolutely everything we can to make sure that your procedure goes along safely and they're able to go back home to your family. Okay, that's why we use the ultrasound for your fat transfer. That's why we have that JCO certification, etc., everything that we do to make sure that you are safe. Of course, you want consistency, so a surgeon that's putting out great results over and over again on a daily, weekly basis, short-term results, long-term results. That's, of course, very important. Someone with experience who knows what they're doing, who's done this, multiple times over and over again with different foundations, and kind of knowing what needs to be done to adjust things to try to get the best long-term results as possible. Okay, so of course, and on the realm of safety, it's also kind of someone that has, I guess I could have put it here, but a low complication rate. Okay, definitely complications are going to affect your results long term. So, for example, an infection. An infection can, potentially, allow things to stay swollen for, extended periods of time, or if you have to, drain something, that's going to create additional scarring, and then also, lack of volume in the area that had to be drained, if we're talking about a BBL. So you want to have, low infection rates, as low as you can. It's never going to be zero. All right. There's no surgeon out there that can have a 0% complication or 0% infection rate, but you want to keep that as low as possible. Okay. You want to minimize, potential things such as, skin necrosis. Okay. So you want to go to a surgeon that's safe, that does things in a way that the skin doesn't die, or nipple necrosis. Those are two big ones. Lipoburns, things like that. So again, while none of these things are going to be 0%, you want to go to someone who has, very low, lower than national average rates for all these sorts of things, because complications will lead to then suboptimal results in the long term. Okay?
Really quick, when you were talking about symmetry, if you have a patient that wants symmetrical hip projection, how do you make sure that it's as symmetrical as possible?
Right, so we always try to, create a very symmetrical look on the OR table, okay? But there are some things that, like I said right here, that we cannot control. There's just some things that I'm not able to change. For example, like I said, some scoliosis or asymmetry in your skeletal structure. So if you have some pelvic tilt, you're always going to have one hip that's a little bit higher than the other. Okay, I can't change that. I can't reset the pelvis. Sometimes we can try to camouflage things a little bit with adding more fat in one area versus the other, but it's not going to be perfectly symmetrical. And then if you're talking about, that fat transfer in BBL, unfortunately we can't control exactly how much fat will survive. And it may not survive exactly the same on one side versus the other. And that's even if you do things 100% perfectly, which of course nobody can do because we're not perfect beings. So, if for example you say you have a tendency to lay on one side just a little bit more than the other, that's going to affect long-term outcomes and things like that. So yeah, I'm not perfect, but certainly no patient is perfect either. And so that's why all these things can be affected long-term. There's just some things that neither the patient or I can completely control. Okay, and it just has to be accepted as part of life and part of your surgical recovery. Okay?
Yes, sir.
All right, but the next thing, which is extremely important, is your post-op care, following up on all your post-op care and instructions, right? So definitely it's not good enough just to go in the day of surgery and then, forget about everything else, okay? If you do that, you're definitely not gonna have a great result long term. So it's a commitment. It's a commitment, okay? You have to make sure that you follow all of your surgeon's post-op instructions to the T, okay? So if your surgeon asks you not to put pressure in the buttock and hips for 6 weeks, then certainly do your very, very best to minimize that. You want to sleep face down. If you do sit, use that BBL pillow. Okay? If post-op lymphatic massages. So massages are incredibly, incredibly important after Lipo 360 or BBL. We typically say that you're going to need somewhere at least 15 to 20, sometimes more, in order to optimize your results. And you have to be able to think about this ahead of time and budget for these types of things ahead of time as well. So if you got into massage number 20 and you need more, then you have to have the ability to do so. Okay, you have to do whatever needs to be done, okay, to really, really try to optimize your results. But don't think about having less than that. Don't think that you can have a Lipo BBL and just forget about your massages and still have a great result. It's not going to happen. Okay, all these steps are necessary to get you to that final point. And like I said, your post-op care is just as important as the surgery itself. So there is a lot of responsibility for the patient in the post-op period. Okay, so we do give you kind of detailed, written down instructions in terms of what you need to do post-op for each of the individual procedures. And of course, it's different for say breast aug versus a tummy tuck versus liposuction, etc. And all these instructions, we've come up with these out of thousands of cases and multiple years of experience. And it's extremely important that the patients try to follow these to the T. Okay. Compression is another big one. So compression is a little bit tricky, right? But you have to listen to like all the nuances. For example, it's actually detrimental, not a good thing, to over compress early in the post-op period, especially the first 2 weeks. Over compression in the first 2 weeks can lead to problems. It can lead to basically skin dying because things were too tight early on. Okay. Which then some people try to blame on lipoburns, but it's not. You're compressing too much. It can lead to actually increased risk of fibrosis and scarring if you overly compress early on. It can actually lead to increased risk of irregularities in the skin, so contra-irregularities as well, especially if that super tight garment created some sort of crease. Okay, typically sometimes we see creases that go in this direction. Okay, in a horizontal direction. I never lipo, and most surgeons, almost nobody lipos in a horizontal direction. That's not caused by lipo. That's caused by a crease from overcompression or improper compression. Lipo typically goes in these directions, up and down, a little bit angled like this, but never across like that. Okay, so when you see something like that, a crease that goes this way, that's typically from an issue with your compression garment.
Thank you. So you have post-op instructions specifically for each surgery.
Yes.
In those instructions, are there guidelines if there's any irregularities, like if they notice something that could be an infection, what to do or how to notice it?
Yeah, I mean, there's some, we give you kind of some indicators as to how to identify some of these things. And then, of course, we always tell you the next step is contact us, all right? And that's very, very important. So you want to go to someone where you can contact, the clinic, the staff, the surgeon fairly easily, and that they're able to get back to you quickly and efficiently. Okay, so for example, here at Pure, the best way to contact us is through Clara, which is our HIPAA-compliant messaging system. We have two nurses. We have our nurse practitioner and our nurse and another nurse, Sarah, who are going through all these Claras, making sure that we get back to you, giving you all the recommendations that we need to do in order to kind of deal with the situation. And it's a great point, because if you catch an infection, or say for example an infection, if you catch it early on, then sometimes you can take care of it with simply with oral antibiotics or even an antibiotic ointment. Okay, but if that goes on for too long, then sometimes that's not enough. Then you have to go to a hospital sometimes to get IV antibiotics, or it may require surgery for either a debridement or a drainage. Okay, so it's you want to try to get on these things as early as possible, and that's part of that being able to identify things so that we can then take care of it. Okay, so that has a lot to do with education. So we spend a lot of time, not only these live, but these live sessions on social media, on Instagram, when you're here, when you're speaking to our nurses, when you're speaking to me, and in your written instructions, trying to educate the patient so they know what to look for.
Thank you. How long after BBL can we start cooking and cleaning?
Well, the key is you're not supposed to do any heavy lifting or strenuous activity for the first 6 weeks, okay? Now, I mean, for most cooking, it's not too heavy, not too strenuous. I think it's okay, especially if you have someone helping you out. For some of the vigorous cleaning, like mopping like a whole house or things like that, you do want to take it easy. So it's best if you can get someone to help you in terms of that. But the key point is, no strenuous activity. Don't lift anything more than 10, 15 pounds max in those first 6 weeks.
And you could start working out after those 6 weeks?
Okay. Yes, so 6 weeks. 6 weeks. So 6 weeks is when life gets a little bit more back to normal. This is pretty true of almost any surgery that we do. At 6 weeks is when you can head back to the gym. You can start lifting, the things that are over the 10 to 15 pound limit. You can start sitting if it's a BBL, sitting normally on the buttock as well. And then swimming or submerging the body under water, bathtub, jacuzzi, all that stuff can happen after the 6 weeks. Okay?
Yes, sir. And one quick question.
Yeah.
Can we get on a plane 4 days after the BBL?
No. So our rule here is 5 days. Okay? So your minimum stay is through post-op day 5. And that's what we require of all patients.
All right, and actually another one?
Yeah.
Many more. This one, can a patient request what time they want their surgery to be at? The morning, the first, second, third, or one of your 5 slots? So can a patient request it? They can certainly request it. Are we going to grant it? Not necessarily, okay? It depends on many factors, like what other patients are scheduled that day. So if we have patients that are either a little bit older or they have some comorbidities such as high blood pressure or diabetes, those patients tend to go first. Okay, so like the super healthy patients, will go, second or third or whatever, if we have someone like that. Now, if everybody is, has no comorbidities, no issues or anything like that, and you make a request and nobody else wanted it, then yeah, we'll try to grant it as best as we can. Okay, but we'll take that kind of on a day by day or case by case type basis. Thank you very much.
The other thing is, I put patience twice. Okay. But the other thing is patience. Patience is extremely important because you're not going to see your results right away. Okay. Remember how we always talk about that physical and emotional roller coaster. So it goes down and up like that. And then hopefully you'll keep going up in this direction. Okay. Where this is time, and this is around here is your surgery day, okay? And the reason that happens is because initially everyone's all super excited, okay, it's surgery day, and then you have surgery, and you're like, great, I made it, I survived, and there's a period of excitement there, but then things start to hit you, right? You start to feel a little bit down, you start to feel something weak. A little bit weak, you feel the pain. There's always going to be some degree of pain associated with surgery. Then all that swelling starts to come in, you get that bruising, things start to look a little bit distorted, and you're like, oh my God, why did I do this, right? That's such a common type of thing that we see. So then you start going down, some people even go into what we call kind of post-op depression. So it really gets, have you heard of, probably a lot of you have heard of postpartum depression. This is somewhat similar. It's not typically never as severe as a true postpartum depression, but it does happen to a certain degree. So we call it post-op depression. That's when people are kind of really feeling down. They're wondering why they did this. Is it ever going to get better? And things like that. Okay. And then once that swelling starts to go away, you start to feel a little bit more energy. Life starts getting back to normal. After 6 weeks, you can do more things. And then you really start to feel good, and you start to see all those beautiful results coming out. And then that's typically about 3 months. Around the 3 month mark, really things start to kind of lift up again. and then continue to improve and get better and better as long as you do the next thing that I'm going to talk about here, okay? But before I go into that, patience, okay? That's why they're called patients. You got to be a patient, okay? It's extremely important, okay? It's extremely important. You got to wait for things to pan out, okay? And while you're doing that, you got to know that, again, surgery by itself, okay, is not the end all be all. You really want to optimize your results for the long run. You got to have the 3 pillars that constitute terrific, great long-term results. And one is surgery, the other one is exercise, and the other one is nutrition. Okay, none of these substitutes the other. Okay, so if you have surgery, just because you had surgery doesn't mean you can then eat whatever you want and not exercise. You're gonna ruin everything within a year. Okay, so and you can't. And then of course we always get that very kind of asinine comment like, "Oh, she should have just worked out." Okay, that's one of my pet peeves. I hate that comment. And exercise alone is not going to be able to achieve what surgery can do, right? There's no exercise out there that can give you a breast augmentation, all right? There's no exercise out there that can fill in hip dips. There's no exercise out there that can really alter the shape of the body and go from a boxy shape to more of a curvy shape. It just doesn't exist. So that's a totally kind of ignorant comment from people that really don't understand surgery, okay? So exercise does not substitute surgery. Surgery does not substitute exercise. And of course, we always have to have great nutrition to heal well, okay, and to be able to maintain your body with your surgery and your exercise, okay? And for certain procedures, such as fat transfer, there's actually specific things about the nutrition that you have to do in order to optimize your results. So we call that feed the fat. So with feed the fat, you got to increase the amount of healthy fats in your diet. And these typically include foods such as eggs, avocado, salmon, of course the red meats as well, nuts such as macadamia nuts. And you may need to supplement some of that, so you can add some milkshakes, you can add a little bit of ice cream there if you need to. And that's really going to try to optimize your results there. Okay, so you have to do all 3, okay, for long-term results, okay? If you don't, then a lot of times your surgery results won't last very long. They may not last a year or so.
So what if you have a patient that's following those 3 pillars and they get pregnant? Will that affect the results?
Yeah, unfortunately, yes. And of course, I'm not gonna, pregnancy is a beautiful thing and everything else, but definitely.
It'll affect breast results, a BBL, even a tummy,
It's going to affect everything, and pretty much anything that we do. So, for the most part, especially tummy tuck for sure. I really don't recommend a tummy tuck until you're done having kids. Breasts are definitely going to be affected by pregnancy and breastfeeding. The BBL, I've seen a lot of people who kind of maintain their nutrition and did some sort of exercise throughout their pregnancy where they didn't just kind of completely balloon up, and then after they've had the pregnancy they've actually kind of been able to go back and kind of restore at least the BBL portion of their body. So that can certainly happen, but for the most part, it just has to be expected that pregnancy is going to definitely affect the way your body looks, of course during but after pregnancy as well.
Can you combine high definition lipo with a lipo 360 on the right body type?
Yeah, and we do that all the time. So basically HC lipo is just kind of an add-on to the lipo 360. So lipo 360, what does that mean? It's just lipo the entire trunk. And so if you want to have that definition, so that high definition of the abdominal muscles, such as the rectus muscles, which are the ones that come here, people typically call like the 6-pack or the abs, and some of those oblique muscles, that can be done at that time.
So if you have a patient who's trying to lose weight to get to that 30 BMI, they have a BBL with you, then after they continue to lose weight and exercise, does that affect their results?
To a certain degree, yes. So once that fat settles, so you're not going to want to do that, of course, while you're healing in the first 3 months, okay? And now if you lose further weight after that, well, the fat in the areas that we transferred and settled, that fat's going to shrink as well. Remember my talk on fat physiology. If you haven't seen that one, that is a great one, and it's on our YouTube channel. Okay, so go to Pure Plastic Surgery on YouTube and look up for the one that we did on fat physiology. But the way that fat cells work is that they don't multiply. Once you're an adult, you have a fairly set number of fat cells. What happens when you gain and lose weight is the fat cells become either larger or smaller. Okay, so if you have a fat cells a certain size and you lose weight, well, then that fat cell will become smaller, meaning that your hips and your buttock will become smaller.
So when would you say the safe time is to start fully just working out after a BBL?
So you can start at 6 weeks. But also the type of workout is very, very important. You don't want to do long cardio type workouts as per BBL. That's going to make the fat just kind of shrink in the areas you don't want it to shrink, like in the hip dips. That's why, have you seen marathon runners? Like most long distance runners, they have hip dips because that fat in that area just completely almost like melts away and shrinks down. Okay, so it's the type of exercise that you're doing. So we do not recommend long cardio workouts after BBL. You want to do more like weights. So whether it's body weight or actual weights, you want to do squats. And if you want to do something, get the heart rate up, then do some high intensity interval training. HIIT training is what we recommend.
Do you advise on vitamins to take to maximize healing and results?
Not necessarily any specific vitamins other than after surgery, you should continue your vitamin C, your folic acid, and your iron supplements to help the body build back up some of the hemo levels that have been, that have likely gone down from the surgery itself.
So I've seen one of your lives before and you explained why you like using drains with your tummy tucks.
Yeah.
Do you ever send your patients home who are from out of state with drains in?
Yes, so sometimes we definitely have to do that. So that's why we like to, like we say, educate our patients and let them know ahead of time that they have to prepare for that. So if you're coming for any procedure that involves a tummy tuck, so the mind makeovers as well, yes, be sure to identify, someone that's going to be able to help you with the drain when you get back home, because it's quite possible that you may have to go home with the drain and then, you'll have to get it out once you're there.
Thank you. So what's this about? Pineapple juice? Do you drink that before or after surgery?
Yeah. So pineapple juice has in it something called bromelain. Okay, bromelain actually helps with inflammation, and that's why we say that pineapple juice is helpful after surgery. Okay.
Thank you. I lost my hips around 8 weeks post-op. Is that normal?
Right. Okay. So that's fairly normal in the sense that is a low point in terms of your fat survival kind of curve. Okay. So that looks very much like this. So in terms of the way that the hips and the buttock look after BBL, it's gonna start off high because all the fat that we put in and all the swelling is there. So I have pretty much 100% of the fat and 100% of the swelling. Okay. Then it's gonna start to come down, and you're gonna hit a low point somewhere around 6 to 8 weeks. Okay. At that point, pretty much most, if not all, the swelling is gone. So you've lost 100% of the swelling, and you've probably lost about 30% of the fat. Okay?
Thank you.
But what happens though, that's the lowest point. Then it's gonna come up. Okay? And let me make it clear here, because it's not as high as when you had all the swelling, but it's gonna be higher than that low point around 3 months. Okay? That's when you're gonna go through that fluff phase. Okay, where everything kind of softens up and fluffs out. So 6 to 8 weeks is the low point, then you're actually going to come up and fluff out somewhere around the 3-month mark.
Thank you. I know you perform breast dogs and liposuction at the same time. Is it true that less fat can be removed during lipo if you're performing a breast dog at the same time?
Yes, so that is according to the rules here in Florida, to the Florida Department of Health. So if you're doing a breast augmentation and liposuction at the same time, they're limited to only 1,000 cc's of fat removal or fat aspiration at that time.
If I live out of state, do I need to come back for my post-op appointments?
So you don't necessarily need to come back. I mean, we always reach out to you at around 6 weeks. Okay, so a lot of these are done virtual, and then of course we also reach out around 3 months. But you can contact us at any time, and if you want to come back, then we are more than happy to see you. Though for most patients, it's tough for them to come back just for these post-op appointments.
When you're performing lipo 360 on a patient, how do you determine which areas to pull fat from versus other areas?
So it's about the shape, right? So we pull fat from the areas where things can create the best shape for the patient in terms of their foundation and what we discussed pre-op, okay? So especially if we know that you have more than the 4,000 cc's, then it's mostly about kind of shaping things in a way, because say for example, it wouldn't make sense that say I just remove a whole bunch of fat from the right side and then I'm up to the 4 liters and I can't do anything on the left, right? That would look very, very weird. So it's about molding and shaping the body to try to create the best shape for the patient given their limitations of the 4,000 cc's.
Thank you. And we're talking about the bromelain. There's also a pill form. Do you recommend that?
The pill form is it's a bit stronger, and when it comes in that stronger pill form, it can potentially lead to a little bit of increased bleeding. So while the pineapple juice, from the beginning is fine, the pill form I recommend that you wait at least 48 hours after surgery to start taking that. So after 48 hours, it's okay. That's different from arnica. Arnica also has anti-inflammatory properties and it helps from bruising. And the arnica you can actually start taking before surgery, during surgery day, and right after surgery. You can take it basically throughout.
Thank you. Answered my next question.
Yeah.
So how soon? So now, if you want a patient who wants the full lipo 360 without the reduced because of the Florida law with a breast dog, how soon after the lipo can you get a breast dog?
3 to 4 months. So you just want to make sure that you're fully recovered from the liposuction procedure, and then you can go ahead and do the breast augmentation. All right.
You've answered this question quite a bit.
Yeah, I'm going to answer this one because I have one more point here that I don't want to forget.
Deal. You've answered this a ton of times. You know this. Why won't you combine a tummy tuck and BBL together? Is that your rule or is that a Florida rule?
It's essentially a Florida rule in the sense that, once again, if you do the tummy tuck, then you're limited to the 1,000 cc's of fat removal via liposuction. And for most patients, that's not going to be a huge difference. And it's not going to be a huge difference in terms of the liposuction, and it's not going to be a huge difference in terms of the fat transfer to the buttock and hips. Only 500 cc's per side. So you're not really getting the bang for your buck. Also, recovery is going to be extremely difficult because you have to be kind of on your back, hunched over for the tummy tuck. You shouldn't be putting pressure on the buttock and hips for the BBL, and that takes us back to here, post-op care, right? We just talked about this, and if you want great long-term results, you have to be able to do the best post-op care, and you can't do that when you're dealing with one thing that's in the front, one thing's in the back. It just becomes very, very difficult, very, very challenging. So in the end, you're thinking that you're saving yourself a surgery or saving yourself an anesthetic, but you're compromising both the results of the tummy tuck and the results of the BBL, and in the end, you're probably not going to be happy with either. And so it just doesn't make sense. It's best to stage them out and to maximize your results with each one.
Thank you. All right. Now your last point.
I have one last point, which is actually, I think, extremely important. One of the most important points here, and which we haven't mentioned. And let me see if anyone can guess it. What do you all think is one of the most important things that you can do in order to, have long-term, long-lasting, great results? It's not something everyone thinks about.
Any hints?
Any hints? It's not something that most people think about, and it's not something that you can really kind of...
Hydration?
You can actually tell someone exactly how to do it.
It's hydration, no smoking, hygiene.
Hygiene's a great one. That's definitely a good
Stable
one.
weight.
Stable weight.
Wear faja.
Okay.
Exercise and diet.
Yes, I love those are all awesome.
Good health.
Those are all awesome.
Yeah, it's great.
And you guys, those are great points, and it really shows me that you guys are educated and really, really know what you're doing.
Mm-hmm.
But one of the things that a lot of people don't think about and is extremely important, not only in your recovery for surgery, but pretty much for anything else, it's this. Positive attitude. Okay? positive attitude is extremely important. Now, I'm not going to tell you that I have a whole bunch of literature on this, but I can tell you for sure that those patients that come in, with kind of like a negative attitude, or they're like, oh my God, or they're very, very nitpicky with themselves, or they're constantly thinking like something bad is going to happen to them, like an infection or some other issue. Unfortunately, that whether you want to call it energy or karma or whatever it is you want to call it, though that is exactly what tends to happen. And then I've had the patients who always come in, they're happy, they're energetic, they have, they're positive about everything. They know that things are not going to, they have realistic expectations. They know that things are not going to be perfectly symmetrical, side to side, and things are not going to be identical twins, et cetera, et cetera. But they have this like really, really positive attitude. They tend to like just sail, through their recovery, and then tend to be extremely happy with their results. Because at the end of the day, when I say pillar of great results, obviously that term, great results, is subjective, right? What one person may think is a great result might not be what somebody else thinks is a great result. Okay, but what I mean by that is how you feel about yourself and about the journey that you just went through. Okay, because at the end of the day, that's the most important, right? So, because there are things about foundations that we can't change and we can't control, and there are certain things, that the surgeon can't control, like how much fat survives, or whether, you unfortunately had an infection or something like that. So there's all these things that we can't control. But at the end of the day, you shouldn't be comparing yourself to somebody else. You shouldn't be comparing your surgical journey to somebody else's surgical journey. You should only be comparing yourself, you to you, okay? And you come out of all of this, better in terms, of how you feel about yourself than before, okay? And one way to do that is to come in with a positive attitude from the very beginning. And how do I help? How does Pure help achieve that for you? Well, we want to make sure that our communication channels are open, and we want to make sure that the patients are educated. We want to make sure that we're doing everything that we can in terms of patient safety, so that when you come here, you're completely comfortable and you're positive that you're going to have a tremendous experience here at Pure.
Thank you very much. We're at 40 minutes. I know you got to go soon. That was way too fast. So
okay.
If there's
awesome. All right. Well, I think that was a great one. I think if please take all of this very, very seriously. I know this one is extremely important, even though it sounds like a little, like flimsy or whatnot. But I can't tell you how many times I've seen a huge difference there just based on the attitude of the patient. Okay. All right. Well, I hope to see everybody next week. Okay, on Hump Day with Dr. Earle. Ciao.